ladies and gentlemen, we move on to the next panel discussion titled AI Trust and Healthcare Marketing From Discovery to Care, Building Trust Across Every Patient Touchpoint. In healthcare, the patient journey begins long before a consultation and continues well beyond it. From the first point of discovery to communication, engagement, and care and trust is central to every interaction. This panel brings together from healthcare, AI, digital advertising, communication, governance, and startup ecosystem to explore how technology and responsible innovation can help build stronger connections with patients and communities. And leading this conversation, we have our moderator. Please put your hands together for Dr. Mridul Rampal, co-founder and chief medical officer of 2Care AI, a voice AI platform transforming patient engagement through multilingual healthcare communication. A very warm welcome to you, sir. And joining him on the panel, we have with us Kirti Yadav from Maringo Asia Hospital, a healthcare growth strategist with expertise in AI-driven marketing, patient engagement, digital transformation, and rehabilitation. A very warm welcome to you, madam. And joining them, we have with us our next esteemed panelist. Please put your hands together for Samir Karpe, Country Manager, India at Double Verify. A big round of applause as we welcome him. Bringing nearly 2 decades of experience in digital advertising, sales strategy, client management, and business growth. And along with them, we'd also like to welcome Mr. Bharat Gupta. Once again, ladies and gentlemen, let's give it up for the founder and chief architect of 2B, building AI-powered communication governance and trust infrastructure for regulated industries. And would also like to welcome on stage Mr. Ravindra MK from Beehive Workspace, bringing valuable insights on startup ecosystem, community-led growth, brand building, and AI-driven customer engagement. Ladies and gentlemen, together we are going to explore how we can use AI technology to build across the trust. So I'm going to hand over the mic to you. So with that, over to Rudal.
Thank you. Thank you, and good evening, everybody. I think we're the last panel, so everybody's quite restless. But yeah, I would say that out of all the industries out there, healthcare carries the most burden of trust than anybody else. And AI coming in would probably like amplify it like much more. And today we have 4 panelists seeing it from like a different angle. So I would just jump right into it and ask the first question to Kriti, that hospital marketing, it's just not, it's not related, it's expanded beyond just attracting patients. So like today it includes remote patient engagement and then education and long-term relationship. How is AI changing this patient journey?
First of all, thank you all health tech team. It's really great honor to be here and sharing my experience. Thank you so much. Okay, so AI is in healthcare has, I would say it's helping in moving the model from episodic to continuous care and from reactive approach to reactive model to proactive model. These are the 2 changes that has been seen. So this is about the patient care. When we talk about marketing, with my experience and with varied startups and hospital experiences that I have, one thing that has been common in marketing when it comes to patient care is patient trust. And whatever we do it for patient trust. If there is a new technology, that has to work on patient trust. If there is new diagnostic that is for patient better care. So one thing common is patient trust. So when we talk about healthcare marketing, it's all about how we gain their trust. And trust is when we do continuous monitoring rather than being episodic, bringing it to continuous. And that is why preventive health check, remote monitoring, AI rehabilitation, which we are using a lot nowadays. We have 3 startups engaged with us in our Neurosciences Institute, where we are using their technology in a varied way. And I would say that is something helping us to gain patient trust and marketing.
Yeah. So like, I'll just move on to Samir. Like in healthcare, where an advertisement is, like where it appears, it can be as important as the message that it gives. And how should healthcare brands think about brand safety and protecting their patient trust when they're placing digital campaigns?
Yeah, right. So, the way we've been talking about patients all through the day, I would, the industry that I represent, we call them customers and consumers, right? And the consumers' consumption patterns are changing. We are consuming more and more digital content. The consumer journeys are not linear anymore. You would discover some ad somewhere on the platform, maybe on your watch. By the time you have watched TV, you are already exposed to multiple digital platforms, right? So it's not linear anymore. Trust and authenticity are important for every business, but for healthcare, it's critical and foundational. And that's where your media quality comes into the picture, right? Where you're advertising, how you're advertising, what you're communicating, and who are you communicating it to is super important. And there are four pillars to media quality. The most foundational is whether your ad actually had an opportunity to be seen in the geography of your choice. These are two things. Viewability is what we call it, and geography, extremely foundational, right? Third is, as digital consumption grows, the fraudsters are also growing, with their schemes, and they're siphoning off a lot of money or your ad dollars by just tricking the entire system, right? So you need to ensure that none of your media dollars are being wasted on fraudulent inventory. The most important that I feel for this forum is the brand safety and suitability, right? Where you do not want to be across any content which is misinformation, because it does a damage to your brand, especially in this industry, which is irreversible. The second is brand suitability, which I would want you to think of that as an opportunity to be talking to your consumers in the right context, in the right frame of mind, where they are looking for information. As the consumption patterns still evolve, we are moving into LLMs now. I don't know how many of us are guilty of putting up our reports onto a chat GPT or similar LLMs to ask, what's wrong with me, how screwed am I? And it tells you you're pretty screwed. Do you want me to tell you what to do next, right? The next evolution here is going to be advertising in LLMs. When they crack it, it is super important for pharma as an industry or healthcare as an industry to be proactive and fight that misinformation there, because it will start showing ads. And like we were talking earlier today, supplements and all, they are telling you some story but not the full story. So I think it's going to be super critical. We already see, and let me also say, this industry has also uh, is one of the industries that has the lowest fraud, lowest brand safety violations across the globe. Amongst any other industry. So it's very regulated, but it also takes brand safety and suitability extremely seriously.
Yeah. Yep. We were having a chat outside, and then we were talking about the same thing. So I would want to add another question is that, as we generate more content by AI, how do you verify that what's real, and when we manufacture at scale?
Yeah, so there are two parts to it. So we have been Double Verify is globally the leader for ad verification, and there are two parts of our business. One is ad verification. The second is ad efficiencies. Wherein we help you buy better, right? Let's talk about the ad verification part of the business, where all the content goes through our universal content intelligence. So frame by frame analysis of what is put up out there. It does text analysis, it does voice analysis, and it tells you whether the content is safe or not. In the same scheme, now we have also started identifying what is AI slop. So one is, you do not, for an industry like healthcare, you do not want to be advertising around AI slop. AI generated content just does not give the same level of authenticity. The second part is going to be around. I'm sorry, I just lost my chain of thought. You asked me about.
How do you verify what's real when it's manufactured at scale?
Yeah, so the other part is our fraud lab, right? Where we have just uncovered one bot. It's not static in nature. What it does is it changes forms every now and then, and it uses LLM to create fraud at scale. So just 3 months ago, we identified this in US, where a search query was being put up in LLM, and the same search query was being picked up by the LLM by these fraudsters, and using the same LLM, they were creating 200 more odd websites which would just siphon off all your money immediately. So that's the level of fraud that has gotten in. you need AI to fight AI. That's how simple it is.
Moving on to Navindra, you work with hundreds of startups at Beehive, and you've seen how trust is built from zero. So, what would be one lesson from the startup world that
Yeah, sure. See, healthcare is not an experimental domain. Most of the people who start a startup in that sector comes from that background. Either they would have faced an issue at the family level, or when they are working in their professional setup, they would have seen the gap. Like some of the startups that pays, they also share the same background, right? That's where the problem statement, the gap, they see a product market fit issue, and then they start up the product and research and everything. So that is where there's a trust deficit. There's a market opportunity that they figure out, and they are hungry for much more hungry than the larger corporations to do something quickly, bring it to the market, evaluate. If it doesn't work, again fail, and start something new in the same domain, right? So startups are really focusing on trust along with the product. For example, whatever they build, they ensure that every customer that they gain, or the cycle that they go through, they ensure that they are over communicated, the problems are solved with whether whatever USPs they have, whether it's the financials or the results, everything they take care of it. Whereas a big organization, they may not focus on the minute aspects. They may not track when is the next checkup that is due. They might mainly focus on the outcome, or ensuring that, okay, the claims are processed, everything is taken care as per the guidelines, but they may not be ready to experiment. Whereas startups are ready to experiment because they are hungry, they are flexible, they are frugal, and people who trust them only are ready to partner with them. So that's one big change. And I think also with the advent of AI, a lot of AI experts are also adding into this value chain. Like in case of you, right? You are also an AI expert, and you have partnered with a business development guy who was in Razorpay, and both are building a product that can scale to the world. So those kind of things were never there earlier, but now even there are LLMs on models specific to the healthcare sector that can be used, and cancer can be detected and scaled aggressively.
as we were speaking of, like my team also works out of Beehive, so I'm one of those 100 startups. Yeah. So moving on, Bharat, I would like influencer marketing. It's growing in healthcare. Like it's been a part of marketing forever, and it's growing in healthcare as well. And you've been, it's just, I think, impossible to review manually thousands of creators. It's not practical. Role does AI play in, creating scalable guardrails for responsible healthcare communication regarding like influencers?
Thank you. So, okay, let's begin like this, that the early journey for marketing was designed at catching more eyeballs. The next phase was optimization, which was around conversion, which was around getting more customers, right? And it is that conversion which has led to lot of, I would say, uh, uh, summarization, or I would say that people have started to expand, or a lot of communication. So, for example, when you talk about creators, why you want to use creators is their penetration across multiple cities in deep levels, their ability to connect with their communities in a voice they best understand. So your objective is to reach out. But what happens also is that a brand wants a faithful recommunication of its positioning. And sometimes a lot of these creators, they exaggerate in trying to get that conversion. And now that is where the problem begins for the brand, because some of those, especially for a category like healthcare, some of those exaggerations can turn into very strong liability for the brand, right? Now, to put a practical perspective, if there are 100 creators who are producing assets and amplifying, your teams can very well manually review them, right? You increase that by 10 times and you say there are 1,000. you can still put a system, and maybe if not in 24 hours, maybe in a week's time, you can review that. Now, again, you multiply it by 10, and now you have 10,000. Can you review that even in a month? No, you cannot. And now you look at a million creators. You look at India has 4 million plus creators. Can you review that manually? No, you cannot. And that is where To Be brings in a governance framework where, we'll take your script as a client and we will determine that which are the creators who have deviated from that script. What is the implication of that deviation in terms of risk? So, also giving you a risk assessment as an institute. And what are the corrections which you need to do? And we offer this not only as a post-publication solution, but also as a pre-publication solution that using a workflow, if all the creators, they submit their assets on a particular destination, we'll do this check and we'll let you know that which are the assets which are governed to go green or get published, and which are the assets which require revision, which are the assets that are in absolute black. So, moving away, as you highlighted, that more from a post-harm addressal system to a preventive harm scalable framework, right? So that is what our objective is. And it's not just limited to creators, I would say. It is also limited, it's also extended to all your brand assets, which is coming through agencies. The same fundamental philosophy, because there are too many fragmented points between clients, agencies, your production house, and finally your amplification agencies, and so on and so forth. And in future, as you articulated, the fear is agentic. And as and when the agentic AI gets deployed to produce highly customizable creatives in order to convert a user into a customer, you don't know the length at which that AI agent can go to persuade that customer, right? So how do you establish the guardrails to ensure that whatever is being communicated is within the framework of compliance, truth, evidence-backed, accountable, and trustworthy? And I would end by saying that while all the earlier efforts were being aimed at getting more customers ultimately, I think it's now time to elevate to the next step and answer why should your customer trust you? And that is where the new world begins.
I would like to quickly ask a follow-up on this. Is like, so according to you, who's the ultimately liable if the AI gets harm? Is it the content creator? Is the brand? Is the platform? Who's ultimately liable for that?
So ultimately, it is the brand who is liable, because very clearly all the regulatory guidelines, they say that it does not matter what you intended to say. What matters is how the consumers interpreted that information, right? So if there is any fault in this line, it is the brand which is ultimately responsible for that harm.
I'll take a question for all of you, starting from Kriti. If in a healthcare organization you can adapt one capability with AI over the next, say, few years, which improves marketing, what would it be, and why would you choose that?
Simply my patient's trust. If AI can do that, that will be the game changer.
But to gain, for the AI to gain that trust,
So I know it's not possible, I would say, because it's to deal with human, and that is what AI cannot do. But yeah, that's my wish. So coming back to the question, what is one thing that AI would? So there are a lot of things that AI is doing, and it's helping us in gaining patient trust. And so what I have seen, being from the clinical part also, I've done clinical, I'm into marketing now. So what I have seen, AI has improved patient outcomes. Clinical outcomes has really improved by using AI technologies and treatments. And that's how patient trust on the brand, patient trust on the doctor, on the individual. And that's how it has been helping. And now when it comes to marketing as a core, then individualized plan, and then retargeting, and then having that assessing on the consumer behavior, patient behavior, and targeting those particular patients that has really helped, that is really helping and would help us further. Thank
Samir,
you.
if you want to like.
Yeah, I think we are at a stage right now where every tomorrow will have more impressions than today, and it is only going to keep on increasing, right? At this point, it is super critical that we shift the lens to marketing responsibly, then marketing efficiencies. We should try and focus more on that. And when I say marketing responsibly, it does not mean that cost escalations come in or etc. I'm just saying that reach out to your audiences in the right moment, and technologies will help you do that. But reach out to them in the right context, right moment, in their right frame of mind. Your marketing dollars are going to work better for you. That's where I think.
See, in my perspective, overall, the customer life cycle, the orchestration, everything from end to end, the customer, the family, everything, if there's one-stop solution that takes care of the customer experience, their well-being, the wellness, I think that would be a great solution, including educating the entire bottom of the pyramid. Currently, the AI is known only to a few at the top. I think if it goes to the bottom, including tier 2, tier 3 cities, then their expectations from the healthcare sector, wellness sector will also be more demanding, so that we can also serve them better with better technology and better online, offline services.
For me, I would say AI is a replica of largely human society, and it's already is giving you signs of replicating greed and power. And the way and at the rate at which disinformation is getting created, if it goes unchecked and surpasses the human moderation, the societies will tend to fall. So I think it's very, very important that we become more conscious about the importance of trust framework, and by design introduce it as a most essential foundational framework within all our institutions and work streams. It's very important to be able to trust the information which is floating around and look at its impact on the young kids or the senior citizens or in every walk of life, from getting rich Ponzi schemes to magical health cures. I think that's the two pillars that drive India. And so I think, especially for healthcare, I would say, there has to be a beginning. We should all think over how should we define trust and what can we do to build support and integrate that framework within our own workflows. Thank you.
I think in the end I can say that marketing in healthcare is also like a clinical outcome. Yeah, that like has to be satisfied. So thank you so much, and I would like to thank the panel, and thank you Karthik
Thank you.
and all HealthSec for having us here. Thank you.
That's about the final panel, and I request Bharat to kindly hand over the gift to all of them, all our panelists and our moderator. Well, ladies and gentlemen, once again, let's give a huge round of applause for all of them. Thank you so much. So all of you together for a group picture. Yes, please. So that was all about our final panel, ladies and gentlemen. One more time, one last time, let's give it up for all our panelists and the moderator. Thank you so much.